We have a few more minutes of our health care roundtable. We have come to a consensus among the panelists here that everyone should be covered in the country and everyone should chip in to pay for that coverage. The question is, how do you deliver that to keep a quality health care system? And Dr. Jeffrey Kang at Cigna, you're talking about you think that those innovations have already come from the private sector. There is a concern, though, that private insurers don't encourage, for example, people to quit smoking, don't encourage people correctly to lose weight or live healthier lifestyles. Have you made those strides recently?
Yes, so absolutely. So we actually give incentives for people to stop smoking or to lose weight. We actually pay them because we know in the long run that that ounce of prevention is worth a pound of cure. So one of the most examples that's really being talked about on the Hill is Safeway. There's an employer that really isn't making an investment in health and wellness. It turns out that Cigna is the carrier underneath that, and we're administering those incentives to the employees so that they stay healthy and well.
And it sort of makes sense that from the private sector, because you can choose to use this product or not. But how do you, Richard, bring that out of the public sector? Because government would become even more big brother than it already is.
Well, there are lots of ways that we have more efficient delivery systems that some of the public sector has driven. I mean, Medicare actually is lower inflation than private health insurance. Medicare's done innovative things like paying hospitals for an admission, so you didn't have to pay them more money every time they put a Band-Aid in. And one of the things we see in the House legislation are actually more ways of saying to a hospital, we're going to pay you for this admission, and if someone turns around and comes to the hospital a week later, you're not going to get more money unless there's special circumstances because you probably let that person out too quickly. We don't want to make more money that way. There's in the bill new accountable care organizations which are providing incentives for more efficient delivery systems. So we need government and the private sector to drive these. As John Rother said, there's a huge amount of public spending in healthcare. There's a huge amount of private spending. This needs to be a partnership where both sectors are driving changes in the delivery system and providing incentives for doctors and hospitals to provide good care, giving them information they need on what the best care is.
John, I mean, you've got to have a comment on this from the AARP. You've dealt a lot with Medicare and Medicaid. Are you happy with the job that they're doing now? Do you think that the government could do a better job in the future?
Well, they could always do a better job. But let's remember, even though Medicare is publicly financed, it's privately delivered. So the hospitals, the doctors, the nursing homes are all private sectors. So I think there's a tremendous amount of potential to do a better job, to be more efficient, to raise quality, improve access. We just have to give people the flexibility, and we have to get away from paying for procedures and pay for value. And I do think there's consensus about that. And if we structure the incentives the right way in both the public and the private side, we could really see our healthcare system do a much, much better job for less money than we have today. I'm
going to have to end it there. That's all the time we have. Thank you so much, gentlemen, for joining us. Jeffrey Kang, Chief Medical Officer at Cigna, Richard Kirsch of Healthcare for America Now, John Rother of the AARP, and Doug Holtz-Eakin of DHE Consulting. It's been a very interesting roundtable. We appreciate you joining us. Now,